Welcome to the weekly dose of self-care presented by your neighborhood pharmacist. Today, we're going to talk about how to address a ear and an eye infection without needing to see the doctor. We're going to talk about what are the symptoms of an eye infection, when is a good time to see the doctor, and what are the over-the-counter options to treat the infection, when you would expect to see improvements, and then we'll repeat the same information for an ear infection. It is not too hard to identify symptoms of an eye infection because when you wake up in the morning, your eyes will be glued shut because of all the crusting around the eye. Other thing is that you might notice some yellow greenish discharge coming out of the eye as well. To remove the crust when you wake up in the morning, simply just use warm water and a face cloth. It is very important to know that an eye infection is considered contagious, so make sure you wash your face cloth every day until the infection goes away, and obviously do not share your face cloth with anybody else. And if you ever touch your eyes, make sure you wash your hands afterwards. For an eye infection, there is potential that the body will just fight off on its own. So the recommendation is to see if there are any improvements after 3 days. If there isn't, then that's when you can try some over-the-counter antibiotic eye drops or just go see the doctor. Another thing is if there's lid swelling. So this might be a different kind of infection where over-the-counter eye drops does not work. Or if you start having some sensitivity to light, or there's some severe eye pain, that's usually some indication that something more serious is happening, so go see the doctor. Polysporin for the pink eye is over-the-counter. It's one of the good antibiotics for general infection. It has ingredients of polymyxin as well as gramicidin. The point of this is to fight off general infections. But if you have tried this and there's no improvement in 3 days, then it's important to see the doctor because you either don't have an eye infection or you have a more serious one which requires a stronger antibiotic eye drop. In terms of how to use it, put 1 drop into the affected eye 4 times per day. Sometimes, if you don't use the eye drop properly, it might make the antibiotic look like it's not working. So the first thing to do is make sure you wash your hands first, then you tilt the head backwards and look up, pull down your lower eyelid to form a pocket, then you squeeze the eye drop into the pocket, then close your eyes for 1 minute, then press your fingers lightly on your tear duct. Longest antibiotic exposure to make sure that it is fighting an infection. If you have any feedback or comment about the channel, please comment below. Otherwise, please like and subscribe and turn on notifications. And I'll see you next Saturday at 8 p.m. Bye!